Now, back to Coastal Living on KZTV.
Hello, everyone. Welcome back to Coastal Living. We're excited for these next guests. Please welcome Elliot Garza with MD Monthly Magazine and Dr. Alexander. Thank you guys for joining us.
Thank you for having us.
We're very excited to have you all. Now, you have been featured on MD Monthly previously, but we are excited to see you. Now, before we start, Dr. Alexander, I would like you to explain this very cool gold skull that you have in the cover.
It's actually a patient's skull that after now.
I'm like, ooh.
It's symbolic because I found it on eBay and it looked kind of cool. So
It's very cool. I love it. That's a pretty sweet decoration. Do you keep that in your office?
I do. I have a bunch
And you
of
tell
skulls.
people like, here's how this is going to go today. No. If it had a moving jaw, that would be very fun. All right. So you practice brain and spine medical practice. Tell me exactly what you do. What part of your profession?
So I do basically all adult neurosurgery. So we deal with both anything to do with the nerves and the brain. So patients with back pain, degenerative diseases, tumors, brain tumors. We also deal with Parkinson's patients with tremors or rigidity. That's very helpful for that too.
Amazing. What are you able to do for those specific clients or patients? I forget the word. What are you able to do for them when it comes to Parkinson's as far as the nerves go?
So we usually put little electrodes in the brain, and that helps stimulate the area where it controls your tremors or rigidity. So it really makes them able to do things they want to do, like eating.
Interesting. Oh, look, we're getting you the old school mic. Nice. There we go. Now you're like a real rock star. So if you want to just hold that up there. There we go. Now we can hear you better. Live TV, ladies and gentlemen. All right, so continue to tell me more.
So Parkinson's surgery is very, very exciting. It's kind of what's cool about neurosurgery, it keeps changing. That it's very innovative, cutting technology. It's every year something new comes out. So we can always offer patients more and more better surgeries.
Amazing.
Smaller cuts, minimal invasive surgeries, and so it's always nice to know what's going on to treat your pain.
And what was it that got you interested? Were you a young child that said, when I grow up, like I said earlier, I want to be a brain and spine surgeon? Or how did you get into this profession?
So my father's a surgeon, and so when I was growing up, we went to the hospital a lot. So actually my whole family, my brother, my sister, and my brother, we all went into medicine. So I always thought it was very fascinating. I thought neurosurgery was it's always changing. You always have to keep learning and keep on your toes.
Exactly, all medicine, especially brain and spine. Ironically, we're coming up with all these new inventions with our brains, and here you are helping people with theirs. How long have you been practicing?
I've been in corpus for 15 years.
And are there any new methods that you want to talk about and share with the viewers that are coming out, maybe for people that are suffering from Parkinson's or some brain diseases?
Yeah, for back surgery, people always have a bad idea that back fusions or back surgery has a very bad connotations. And nowadays we have really small techniques and cool things that we can do to really help with that.
Interesting. And what are we looking at here on the screen? What type of surgery is this?
This is a surgery that we're actually going from the side, and we're doing a minimal invasive fusion. So we're taking out the disc, putting in a spacer and a plate and screws to hold it in position.
Wow, in the spine, which is, two of the most sensitive and delicate areas of the body to work on, correct?
Yeah, it's pretty sensitive.
Especially with the spine. Okay, and for our viewers, what can we do to prevent issues with our spine, with our brain? Are there things we can eat, ways that we can exercise to prevent these problems in the future?
So pretty much you should do a very active lifestyle. You want to be exercising. You want to not be sedentary. Unfortunately, a lot of patients are morbidly obese here in corpus, so weight loss is very important.
And you mentioned really active, and I think for those people sitting at home like, active, they're thinking they need to go do jump squats and run marathons, but you're talking even something as simple as maybe a 30-minute walk.
Yeah, exercise,
each day.
weight training. Obviously, lift with your back, your knees, not your back. A lot of people mess up their back from doing dumb things.
Yeah, and you want to practice proper weightlifting, which we've actually done a couple segments on those, just to make sure, you don't lift with the middle of your back. You want to use your booty and keep your back straight and head up and all that good stuff, right?
Yes.
Awesome. And so, why do you love what you do? It's such a unique profession. I'm sure there's so much pressure on you, both physically and emotionally. Tell me, what makes you so passionate about what you do?
I love what I do. It's not work. It's every day. The whole day can go really fast because it's something. When you like something and you enjoy it, and you help people and do the best you can, it's really rewarding.
Absolutely. And Elliot, tell me, I don't want you sitting here all quiet. He's just sitting here looking pretty like, Tell me about MD Monthly and what inspired you to bring Dr. Alexander onto the magazine.
The coastal band is a very unique market. I have clients from Houston down to Brownsville, Texas. But Corpus Christi has a lot of innovative technology and specialty physicians.
Absolutely.
To where I just want to make sure that the Coastal Bend recognizes the quality physicians, nationally known physicians that are here in the Coastal Bend, to where they don't have to go anywhere else. It's here.
Absolutely.
You know, so save your travels. You don't have to go to bigger markets. The technology and the expertise is here in Corpus Christi.
Amen to that. Well, thank you so much for supporting
Definitely.
local. And we've got some of the information up there so you can learn more about Dr. Mathew Alexander. On 3rd Street, there's a Corpus Christi office at 1227 3rd Street, and there's a Victoria office as well, 302 East Airline. Contact them at 576-1411 or 883-4323. Thank you so much for joining us today.
Thank you.
Before
Thank you
we
for
go,
having
what
us.
has been your biggest accomplishment, would you say, that we want to share with our viewers? Any big surgery that you overcame, something you were nervous about, a big study that you did? It could even be in your personal life. Maybe it has nothing to do with.
I think lots of times even the small things that you can encounter can be huge, and sometimes you have to be very humble, because if you're kind of cocky, God always kind of puts you down. So
Yeah, has a way of putting you back in your place. Nope. Awesome. So
He does have great testimonials on his website if you go to social media as well.
awesome.
I can vouch for him as far as his accomplishments and what have you. But I'm very proud of you, Dr. Alexander. Thank you for everything you're doing for the community.
Amazing, yeah. And on behalf of the Coastal Bend, thank you so much for everything that you both do for the community. Thank you, Dr. Alexander, for visiting with us.